The AML19 trial recruited over almost 2,000 patients over a period of 5 years into two different major randomizations. Firstly, for patients not known to have adverse risk cytogenetics, and there was a second randomization for patients who were known to have adverse risk cytogenetics at diagnosis, which represents a very poor risk group. The data on the outcomes for both of these two upfront randomizations have been presented at this meeting. In the larger randomization for patients with what we might call standard risk AML, we randomized different doses of Gemtuzumab Ozogamicin, or GO, and we randomized different backbone chemotherapies, basically DA, a 3+7-like regimen, and also FLAG-Ida. And the results demonstrated an event-free survival benefit for the FLAG-Ida GO arm. That means FLAG-Ida GO is Gemtuzumab Ozogamicin over the DA-GO arm. However, in terms of overall survival, there was no significant difference. However, there was a significant reduction in the risk of relapse in patients receiving FLAG-Ida GO. The hazard ratio was about 0.56, so it's a really high major difference in relapse risk. And this translated into a survival benefit in certain molecular subgroups, particularly those with NPM1 mutated AML and those with FLT3 mutated AML. For other molecular subgroups, we couldn't see a survival benefit for FLAG-Ida GO, but the survival benefit for NPM1 mutated disease was quite positive. It was 18% at 5 years difference in outcome between patients receiving FLAG-Ida GO and those receiving DA-GO. And this was associated with a much better molecular response following induction chemotherapy. So that's a brief summary of some of the findings from AML19 standard risk arm. I could continue by talking about the poor risk arm, the adverse risk cytogenetics, because in that study we randomized FLAG-Ida again, but without Gemtuzumab, because we know that those patients don't benefit from Gemtuzumab, so they had FLAG-Ida without the Gemtuzumab, and that was randomized against CPX-351. And although there was no overall survival benefit in that trial for either arm, there was a relapse-free survival benefit for the CPX-351 arm. And also when we did molecular genomic studies on this population of patients who was enriched for very adverse risk cytogenetics and enriched for adverse risk genomic mutations, particularly TP53, we found that those patients with a genomic diagnosis of secondary AML clearly benefited from the CPX-351 with a survival benefit. Although it wasn't seen in the overall randomization, in the subset of patients, about 35% of patients who had secondary AML gene mutations, there was a CPX-351 survival benefit. So we were very interested with that result.